As most of you know, the Children's Bureau is the federal agency responsible for implementing child welfare laws, supporting and monitoring states, and a growing number of tribal child welfare agencies, and for improving child welfare outcomes in the United States. Troubling trends of increasing foster care populations and reports of maltreatment, along with unsatisfactory outcomes for children and families, clearly demonstrate a need to transform the child welfare system as we currently know it. To reverse these harmful trends, the Children's Bureau's top priority is to reshape child welfare in the United States, to focus on proactively strengthening families through primary prevention of child maltreatment. The transition to a proactive prevention services approach requires a shared vision. It requires leadership and ownership of the outcomes that will be achieved across the broader child welfare system. The Child Welfare Agency cannot and definitely should not attempt to address primary prevention independently from the other critical agencies and organizations that also support children and families. The Child Welfare Agency should actively seek, engage, and sustain the involvement of leaders across the branches and levels of government responsible for operating child welfare systems, especially the legal and judicial community and prevention partners in designing and implementing their jurisdiction's visions for serving children and families better. Moving to a primary prevention approach provides an opportunity for a child welfare agency to partner with community-based providers to respond proactively to the needs of children and families in their communities before they reach a level of risk or danger that puts their children in harm's way. Community providers are uniquely well positioned to partner with the government and the community to implement, adapt, or even create programs, services, and interventions because of their local knowledge and their commitment to the needs of families in their communities, the cultural norms and expectations, and the formal and informal support systems that can be mobilized on behalf of children and families. Child protection will always be paramount and will always be needed, but we should do everything we can to reduce that need for foster care. We can and should reach for balance in our system and place a much higher priority on keeping families safely together. Our shared goal and mission must be to prevent the trauma of maltreatment from happening in the first place by strengthening families through primary prevention and helping them to thrive. The well-being of our nation's children and families depends upon it.